How to cover the image-based question of entrance examination, NEET PG, INI and FMC. Hi friends, I am Dr. Rishikesh and I secured a rank of 314 in this year NEET PG exam. This is my intern attempt. And in this video, I will cover the topic of image-based question subject-wise. How did I cover each subject images and what are the sources and how you are going to get these sources. So this video is going to be very useful for you friends, as the number of questions are on increasing trend from the image-based questions even in the NEET PG and in the INI also. So do listen to these 8 to 10 minutes and you will be through the most important points that are required for the image-based questions for the entrance examination. Also in the last part of this video, I will share my Telegram channel ID where I share some of the important PDFs that may help to improve your rank. And I will tell the single most important source to cover all the instruments at a single place of the clinical subjects like ENT, ophthalm, surgery, medicine, obs, gynae, orthopedics, PSM. So do listen to the video till the last part of the video and you will be getting the most important points to cover the images of the entrance examination. So coming to the video, I have made the video in a sequence from the first prof to the final prof.
I will discuss this video subject-wise and professional year-wise. Coming to first year, first I will discuss about anatomy. Friends, for anatomy, I used videos of cadaveric images that are freely available on YouTube by Dr. Ashwini sir. Here sir has explained all the system images with a separate video. For example, there is a separate video for upper limb, similarly for lower limb, abdomen, pelvis and head and neck. So you can also extract maximum benefit from it by watching freely on YouTube. What I used to do, basically I used to take a screenshot of these videos and make a PDF and used to revise multiple times before my examination. And a couple of questions will be coming from this section in your INI exam, and rarely questions are asked from the cadaveric section in your NEET PG. So if you are targeting your INI exam, you must cover this cadaveric images section. And for the rest of the anatomy images, basically I prepared from my sources only and the PDFs that I shared on my Telegram channel. You can watch this video for anatomy as a subject preparation for entrance examination that is made by me only, and here I have covered all the must know and enough resources for your anatomy preparation for entrance examination. Now coming to physiology, and here mainly images from graphs come, and to cover this you have to revise multiple times the graph module of BTR compiled section. Here ma'am has compiled all the graphs at a single place that are asked in entrance examination. Also, I have made a separate video for physiology to cover the basic and essential sources for the entrance examination. But for images section, you have to cover this graph section for your entrance examination. Now coming to the last subject of the first year, that is biochemistry, and here I have no special source for images. I've only covered the sources that I mentioned in my subject-wise strategy for biochemistry. But for images, you can cover the enzyme kinetics graph in this section because that are asked in NEET PG and INI also. Also, some of the clinical images of pellagra or vitamin A deficiency are coming, but that are very easy and you can easily crack these images. So this is for first year. Mainly you have to cover the cadaveric images as a separate source and graphs module for physiology, and if you want to see the enzyme kinetics graph in biochem section, and you are done with your images in first year subject, and you have to do the sources that I am telling in my subject wise strategy video. Now friends, coming to second year, and first we will see about pathology. For pathology, mostly the questions are asked from the histopathology section, and single best source I have mentioned in my pathology preparation video also for the pathology images is the histopathology compiled section of Zenobora ma'am. Here ma'am has compiled all the histopath images of the diseases that are asked in pathology in a single PDF only. So you can revise all these in a single place. Also, if you do the rapid revision of Preeti ma'am, the last section is for only the image based question. So you can cover other images like vacutainer images and hematology practical, the RBC pipette and the WBC pipette also you can cover from that rapid revision only. So to cover the images, you have to do the histopathology of BTR, and rapid revision last section is of images only. So I use these sources only for images of the pathology. And to cover the pathology as a whole subject, as a subject-wise strategy, you can see this video. This video is made by me only. Now coming to the microbiology section, and for microbiology, I use this compiled images of the culture in a single page. I used to visit this multiple times before my examination. I have shared this on my Telegram channel only. And for the eggs of the parasite, I basically use the marrow pulse section. Just search the eggs in the pulse section of the marrow, and you will see the pulse of the eggs of various parasites. So you have to revise the eggs images of the various parasites because questions are coming from that section. And for other images, the microbio rapid revision of Preeti ma'am is enough. So for images, you have to do this culture images, compiled photo, and marrow eggs pulse, and the sources that I have mentioned in my microbiology video only. And this will take care of your microbiology section images. Now coming to the forensic medicine part, and for forensic medicine, I have made a compiled image of all the toxins, all the plants that are toxin in a single page, and used to visit multiple times because they are confusing plants, and you have to answer these image-based questions when they are coming in the entrance examination. For that only, I have made this compiled toxicology images page, and I will share this on my Telegram channel. For the rest of the images of the injuries images, the gunshot injuries, the snake images, or the torture method images, all are covered in the BTR and bonus BTR section. So to cover the images of FMT, you can use this page and rest from the source of the BTR and bonus BTR, and you will be done with your FMT images. No separate source is required for covering FMT after this. And the last subject of the second year is the pharmacology, and nothing special you have to do for the images of the pharmacology. Only see the general pharmacology and ANS images, the images of the antagonist and dose response curve, and competitive and non-competitive curve, and also the rabbit eye experiment image that I have shared on my Telegram channel. So you have to do these graphs only for the pharmacology, and you are done with your pharmacology images, because more than nothing is asked from the pharmacology section regarding the images. So this is for the second year. Basically, you have to cover the BTR compiled section of histopathology images, the compiled culture image that I have shared on my Telegram channel, and see the pulse of the eggs section of the parasite. And for FMT, the toxicology compiled image, and for pharmacology, see the general pharmacology curves and ANS experiment curves of epinephrine, norepinephrine, and rabbit eye experiment. Now coming to the third year, and for third year, first we will see the PSM part. And for this, the health program logos, the questions are asked from this section. This year also the question are asked, so I have prepared this from compiled section of the logos, and I have shared this on my Telegram channel. For the rest of the images, I have covered only from the sources that I mentioned in my PSM preparation strategy. Basically, more than this, nothing is asked as a separate image-based question in the PSM part. So do prepare the logos well and from the sources, that is basically the rapid revision of marrow, and you are done with your PSM images. And very easy questions from the images of the PSM are asked. Basically, the letharism image or the food adulterant images are asked, that are covered in the rapid revision only. So do the logos and the rapid revision properly. Now coming to the ENT section, and for ENT I have used a separate source, and that is image based question discussion by Dr. Vaishnavi ma'am of Prep Ladder, and this source is freely available on YouTube, and you can also watch this and extract maximum benefit of it. Here she has discussed the ear images, the middle ear images, and the images of nose, pharynx and larynx, the important images that are asked in entrance examination in single video. Similarly, for ophtha, I have used Dr. Neha Agarwal ma'am one-shot revision. Here she has explained all the ophtha images with some of the theory content also. So if you have to revise your ophtha with images as well, so you can do the ophtha one-shot revision of e-Gurukul, that is freely available on YouTube. So for these two short subjects of ENT and ophtha, images may come in INI as well as NEET PG. So do prepare these images from the sources that I mentioned. Dr. Vaishnavi ma'am of e-Gurukul, freely available video on YouTube as image-based question discussion, and for ophtha, one-shot revision of ophthalmology by Dr. Neha Agarwal ma'am of e-Gurukul. Now coming to the final year subjects, and first I will discuss the medicine and surgery, because for them I have not prepared a separate source for image-based question. But what I did, basically I covered the sources very well, because the images are there in my sources video only, and the sources that I prepared. So you have to do them very carefully and repeatedly to cover the images as well as the content there. But if some question come and the images I don't know, then what I do, basically I just get the screenshot of that image and compile all that image in a single page. For example, if I gave a GT and I was not able to solve 4 to 5 question of image based, basically I compile them in a single page, and I used to see that image, see that page, because that will cover 4 to 5 images in one page only. So that will save my time and also will help to compare the image with other. That will make a photographic memory in my memory. This worked for me. Maybe it worked for you or not, but this is what I have done for the images of medicine and surgery, because I have not prepared a separate source for them. And I will also make a video how I used to compile these images in a single page, and what app I use, and what are the tools that I use to make these PDFs and compile the images in a single page. Now coming to the OBS and Gynae section. For the OBS and Gynae section, I used free videos by Sakshi ma'am on YouTube, and that are separate videos for obstetrics and separate video for gynecology. And here ma'am has beautifully explained all the entrance examination questions from the images section of obstetrics and gynecology. Also, I have covered the rapid revision of the ma'am only, so it helped me to cover the images very quickly, and questions are coming from these sources only. So you have to do the freely available source that is present on YouTube for the images of the OBS and Gynae, and you will be done for images of OBGY section. Now coming to the pediatrics section, and for the pediatrics I have done nothing special for image based question, because most of the images, the milestone images and the genetic syndrome images and the images of the scalp swelling and other images of the graphs, the growth curves, are explained very well in the BTR and bonus BTR. So the theory content and the images are covered in one place only. So I have done nothing special for PEDS images section, and questions are coming from these sources only. The growth curve is asked from the BTR and bonus BTR only, and also the milestones that are asked are present in the BTR and bonus BTR. So no need to do a separate image based source for PEDS section. You will be done for your images by doing BTR and bonus BTR only. For orthopedics you have to do the BTR and bonus BTR only. Again, no need to do a separate source, because all the images, all the X-ray images of the skulls that are asked, all the vertebra images and all the images of the tumors and all the pathological images also are present in the ortho BTR and bonus BTR. You can also check by yourself only. Give a look only and you will understand why I am saying. So for ortho section, you have to do the BTR and bonus BTR. No need to do separate section, separate image based section for it. Now coming to the radiology section, and as you know, radiology is full of images, and also a lot of questions are asked in this year. So you have to prepare radiology very well from now onwards. So what I used for the images of radiology is basically the rapid revision of Senavora ma'am. She has compiled all the important entrance examination images of radiology section in a very short span of a time, and a very easy method to understand. And if you don't have this source, then you can either choose Marrow Rapid Revision or Nikita ma'am Rapid Revision. If you have done any of these source earlier, then no need to change the source. You have to do your earlier source only, and no need to change the source now. Now coming to anesthesia, and here a couple of questions from images can come. For example, the capnography image, the images of the oxygen cylinder or the inhalational gases boxes, and even more questions like that. And all these questions are covered in the BTR and bonus BTR of Zanavora ma'am. So you don't need to go for any extra source after doing BTR and bonus BTR for images of anesthesia. Now coming to psychiatry section, and as you know, in psychiatry there are not a lot of images from psychiatry section. Only some images like Frigoli syndrome or some personality tests like Rorschach test images can be asked. Then these are all covered in the BTR and bonus BTR. You can rely on them surely for your images of psychiatry. Now coming to the derma section, and surprisingly a couple of questions may come that is not covered in your rapid revision and BTR. If such a question come across in your entrance examination, you should leave that question if you don't know any of the options.
and leaving that question will not drop your rank, because you have to do only 160 to 70 question correct for a top rank. So if a such type of rare question come, you should either see if you know any of the options, then rule out that question, or if you don't know any of the option, then just leave that question and cover your 160 to 70 questions correct in the entrance examination. So basically the resource will be for images of the derma is basically the BTR and bonus BTR itself. And if you do the previous year questions and come across images that you don't know, do click them and make a single pages of 4 to 5 images so that you can see them at once and cover multiple images in one picture only. So this is the source for images of the derma that I have done during my preparation. Now coming to the source that I said in the starting of my video, the best possible source to cover all the instrument of the clinical subjects like ENT, Ophtha, Obs-Gynae, surgery, medicine and orthopedics. What is the best possible source to cover all these instruments in a single PDF? And that is none other than the BTR compiled module of instruments. Here ma'am has compiled all the instruments in a single PDF. So you can cover all these instruments at a single place, because a couple of questions may come from the instruments in NEET PG as well as INI. So do cover this PDF multiple times. So do see the instruments at one place only and get 1 to 2 questions from it correct in your entrance examination. So friends, this is all for the images sources that I used during my preparation. I have mentioned all the sources, the free YouTube sources that I used. You should also extract maximum benefit of these sources and you will get through your exam. So keep studying friends, be confident, never ever lose hope in your life. And if you like this video, do share and subscribe the channel. We will meet in next video. Till then, goodbye and stay happy.